caries? What is decay?
First of all, Dr. Ranjani, thank you so much for inviting me today for today's talk on patient dental health awareness, which I think is a kind of I would say, a mission for me that's pretty close to my heart. And we did have discussions about this a couple of years ago, right? I mean, we did discuss and say how it's really important that our patients understand some very basic aspects of oral health. So thank you so much for inviting me today. And yes, of course, I think the very basic issue that most of us face today, either ourselves or our kids or any elders in the family, is a tooth problem. And we all know tooth problem is basically a gum infection, which is a bleeding gums, or a tooth decay, which generally leads to a tooth pain. So like you said, most of our patients do come to us and ask us, why is it that I develop a tooth decay in spite of, taking utmost care. Now, what is this utmost care that they are taking? Is it something that is monitored well by their dentist? Are they getting enough feedbacks? Because I think most of them assume that, hey, what, I'm brushing my teeth, I brush my teeth, and I'm doing all that. So I think a lot of aspects go into how to brush, the kind of brush you need to use, the kind of paste you need to use, and all the other aspects, and also the correct method of brushing. So that's one part. I think as dentists, when we do a one-to-one, when we are with our patients in our clinic and we tell them, we do guide them and tell them on all that. So coming to today's topic of discussion, which is tooth decay, and why a tooth decay happens, and what exactly is a tooth decay. Tooth decay, very simply put, we would say, is a bacterial infection of the tooth, or rather the hard structures of the tooth, which involves the enamel, the dentin part of the tooth. So any part of the tooth, whether how we consider the tooth to be in two parts, like if I can show you, the structure of the tooth, if it looks like this, the tooth has what we call as the crown portion and then the root portion. So this crown portion of the tooth is what we can see in our mouth, correct? And this is the root portion that lies within the bone in the jaw, covered by the gums. So technically speaking, a tooth decay can happen to any part of the tooth, whether it's the crown portion of the top or the root portion. So generally, the crown portion is in younger patients, the crown portion is what gets affected. And this is, again, we say it's a bacterial infection of the teeth. Now, how does the bacterial infection happen? Where does this bacteria come from? This bacteria is already there in our mouths. It's present in our mouths. So probably there are some aspects related to oral hygiene or the structure of the tooth and the other factors that allow these bacteria to become more active. So what do these bacteria do? They use the remains of the food available on the tooth surface, utilize this and release acids which dissolve the tooth. Now, the enamel, we say, is the strongest part in the entire body. I mean, it's really strong. 99% of it is, hard material in that, like calcium. So how is it that this particular hard structure, the bacteria is able to penetrate such a hard structure? Now, this is, again, when we look at, when we say the etiology of dental caries, we say what are the factors that contribute to dental caries. One is, of course, the host, which is the tooth structure. The other is the bacteria, the microorganisms. And the other is the diet or the food that we eat. And another fourth component has been added to this three component, the triad of the etiology of tooth decay, which is the time factor. Now, this time factor is something which is very critical. Now, we could eat something, like you said, most of our patients say, I don't eat sweets, but still I have, tooth decay. Now, sweets are not just the only ingredients, that can cause a tooth decay. Any food that is sticky, that remains on the tooth. So this is where the time factor comes into play. Anything that remains on a tooth for a long time can initiate a tooth decay because the bacteria is getting so much more time to remain in one place and do all their activities, release all their acids, and weaken the tooth in that particular point. So when we say tooth decay, it is multifactorial because there are so many factors that are involved in it. And that is the reason why when it comes to oral hygiene practices, you'll have to focus on each one of these points to prevent a tooth decay.
I'm glad you brought up